A staggering number of Ohioans face rising insurance costs, with health experts warning that over 500,000 residents could lose critical financial assistance starting next year. The crisis is compounded by a projected loss of coverage for nearly 100,000 individuals, who will struggle to afford premiums under the new system. This is where the debate truly intensifies. While some argue the government should prioritize immediate relief, others insist the long-term consequences of cutting these subsidies could be catastrophic. The subsidy, known as the Enhanced Premium Tax Credit, was introduced during the pandemic to make health insurance more affordable for those earning between 100% and 400% of the federal poverty line. For a family of 3, this translates to an annual income range of $26,650 to $106,600. Over 20 million Americans and 530,000 Ohioans benefit from this program, which has been instrumental in reducing the uninsured rate to historic lows. However, its expiration at the end of 2025 could trigger a chain reaction of economic hardship. More than 90% of marketplace enrollees rely on these subsidies, saving an average of $700 annually. Yet for some, the savings are minimal, leaving them with little to lose. A recent report highlighted a hypothetical scenario. A 60-year-old couple earning $82,000 would see their monthly premiums jump from $581 to $2,111, a tripling of costs. $18,400 in annual savings. This underscores the program's role in making healthcare accessible, even for those in high-income brackets. The subsidies have contributed to a near uninsured population, with 2023 data showing the uninsured share of the population at its lowest point in decades. However, this progress has not gone unchallenged. President Donald Trump's efforts to repeal the Affordable Care Act, ACA, and his proposed Medicaid cuts have sparked fierce debate. Critics argue that eliminating these subsidies could push the uninsured rate back up, especially as states like Ohio face growing challenges from reduced Medicaid funding. One of the most contentious proposals is the One Big Beautiful Bill Act, which aims to cut $1 trillion in Medicaid spending over a decade. While proponents claim it will boost the economy, opponents warn that this could lead to millions losing coverage, particularly in rural areas where hospitals are already strained. Emergency physicians have warned that the sudden influx of uninsured patients could strain hospital resources, forcing providers to ration care or increase wait times. The stakes are even higher if the subsidies expire. KFF estimates that 16 million Americans, including 440,000 Ohioans, could lose insurance due to both the subsidy cuts and Medicaid reductions. Health advocates argue that the ACA's tax credits are a lifeline for many, and their expiration would leave vulnerable populations without access to essential care. A non-profit advocacy group, Americans for Healthy Communities, urges Congress to extend the subsidies before it's too late, emphasizing that the window for action is narrow. Congress has until September to act. Despite the urgency, officials from Ohio's Republican Senate, John Husted and Bernie Moreno, have not publicly commented on whether they will renew the program. Their silence leaves the question unanswered. Will they step in to protect Ohioans from the fallout? Meanwhile, the broader political landscape remains divided, with some Republicans advocating for limited changes to the ACA and others pushing for comprehensive reforms. As the deadline approaches, the debate over the ACA's future continues to heat up. Will lawmakers prioritize the health of millions or the political agenda? The answer may hinge on whether they can find a balance between fiscal responsibility and social equity. For now, the spotlight remains on Ohio, where the cost of care is rising and the need for action is more urgent than ever.